Thank you very much, Chairman Brady, and thank you, Ranking Member Neal, and everyone who worked so hard to bring this package, H.R. 5774, the Combating Opioid Abuse for Care in Hospitals Act of 2018, before the committee today. Tragically, thousands of lives have already been lost to opioid-related drug overdoses. I applaud this committee's extensive efforts to combat this crisis, which has hit my state of Florida particularly hard, and I'm proud that we have been able to come together in such a bipartisan way. H.R. 5774 includes provisions championed by many members on and off this committee, including Representatives Paulson, Davis, Smith, Higgins, and Buchanan. It includes efforts to review quality and efficiency efforts on the treatment of individuals with substance abuse disorders, provide expert recommendations on reducing the use of opioids in the surgical setting, and best practices for pain management, provide guidance on opioid prescribing. It also includes a provision that I introduced with Congresswoman Kuster, H.R. 5699, the Hospital Opioid Solutions Toolkit. The toolkit will contain resources that hospitals can adopt regarding best practices for provider education related to the screening of at-risk individuals and treatment for pain management and non-opioid alternatives, as well as best practices for tracking opioid prescribing trends in hospitals. It will also provide information on effective patient education. The legislation would require that this guidance is developed by the Secretary of Health and Human Services in consultation with relevant stakeholders, including providers and patient advocacy organizations. This is an issue that affects each of our districts, each of our communities. We need solutions that can help prevent opioid abuse, as well as get people on the path to treatment and recovery. Again, I'm grateful for the hard work of my colleagues and the countless hours committee staff has contributed to the effort to combat this terrible crisis. Mr. Chairman, I encourage all the members of this committee to vote in favor of the measure before us, the Combating Opioid Abuse for Care in Hospitals Act. Thank you, and I yield back.